Thank you very much, Lindsay. Hope you can see the slides, right? So I'll be talking about targeting middle-aged high-risk group for dementia reduction, risk reduction. I have no relevant financial relationships to disclose, and I don't intend to discuss any off-label investigative use of commercial products or devices. So
Abhilash, there's a
just,
little delay. I'm going to turn your video off, but and see if that helps.
yeah, for sure. So the first key point to learn is that there are at least 12 potentially modifiable risk factors for dementia that researchers established, and two lifestyle-based protective factors for dementia. And then I'll be talking about practical strategies. So middle age, whether we like it or not, this is the age range. Maybe 100 million in our country in population-wise. And when I talk about risk reduction, it's important to realize that I'm talking about potential and vulnerability, not inevitable destiny. So again, when we talk about doing all these things, we should not expect that everybody would be able to prevent or delay dementia, but a large amount of people will be. And again, we are moving away from just focusing on removing disability. Once you develop dementia too, how do you optimize brain function, not just for dementia risk reduction, but also, stroke prevention and in general, overall brain wellness. When I ask people, so do you think you'll get dementia? They'll say no. So maybe they're underestimating their risk of dementia, which is all right. Optimism bias is important. But then when I ask people, you know, are you worried about it? They would say yes, and you know, it's important then to address as to what exactly are their concerns. 75% at least say they are worried about future brain health, and the number goes up after you go above 60 years. And when I ask people, so what do you think you should do to optimize your brain health? They'll say, oh, maybe I have to do something more challenging, like, mind games and all. Whereas what I'm expecting, so obviously they have a serious problem with brain health literacy, is I'm expecting that Abhilash, I'm well aware that there are 12 established modifiable risk factors. There are more coming up. Lifestyle is very important, and give a more sophisticated answer. Then why focus on middle age? As you see, if you ask people, did you discuss dementia prevention with your primary care provider? They'll say, not really. And almost 50% would be worrying about them developing dementia. So obviously, we need to do a better job. But just as important is to provide primary care providers with resources. Currently, we are just overburdening them, but we won't go there. Again, if you have a family history, then the number of people worried about future dementia is like 3 out of 4. That's a lot. And again, nobody's discussing this with them. So that needs to change. Every three seconds, somewhere in the world, somebody crosses that line and now meets the criteria for dementia. That translates into 10.5 million people, all right, every year, okay? Just for you to know, 10.5 million people every year. So again, why start in the middle age? So most of the people who get diagnosed with dementia are 65 plus, but if the enemy is getting hold of our brain cells and brain connections 25 years ago, then we need to start studying them 25 years ago. So if I get diagnosed at 70, then maybe I should be fighting, at the age of 45, right? So again, that's where, so all these disease processes, what we call dementias, start really 2-3 decades before, and they slowly build up. So I would say even middle age is starting too late. I would say it's never too early to start with brain health. So, I mean, in the womb, all right? uh, Helping mothers, supporting them so that the baby's brain is superb. And it's never too late, all right? I have 90-year-old who are better functioning than my 60-year-old patients. Again, it's very important to realize that Alzheimer's disease has a long asymptomatic preclinical stage. You're talking about 20, 30 years before one develops symptoms. Now, the classic symptoms are memory impairment. So that's why the diagnosis of MCI, mild cognitive impairment, comes. And then another maybe 5 years you spend in MCI, and then you develop dementia. So again, we need to really start fighting this disease much, much earlier if we want to delay the onset, prevent it. So you say, you said 12 factors. How much do they account for? Well, if you eliminate these 12 modifiable risk factors, then 40% of dementias will disappear. So that translates into how many million? It's a question. Let's see if you're paying attention. Remember, 10 million a year. So if 40% disappear, how many million? That's right. 4 million will not have dementia. That's not a small number. Oh, we still have to confront the reality, right? We have unmodifiable risk factors, unless somebody has figured this out, how not to age. Uh, uh, Age being, unfortunately, the greatest. So let's really come to terms with this and take this seriously, that we have these risk factors. So we are all at risk. Let me repeat it. We are all at risk. The good news is that some of us have protective factors. We all keep talking about risk factors, but we need to realize there are protective factors, including genetic protective factors like ApoE2. Again, a lot of this research that I'll talk about has been done in white populations. So we need to just factor that in and then, have a better reaction to how to help people from all ethnic and racial backgrounds. So what's the first modifiable risk factor? Early in life, secondary school education. So a question for you. Malala Yousafzai is a person who has done more to prevent dementia than anybody else. Let's see if you can write in the chapter, in the chat, what exactly am I talking about? Malala Yousafzai has done more to do dementia prevention. So by the way, every child in our country, if not everywhere else, should have secondary education. Hearing loss. So this was a surprise when it came out, at least for me. So in the past, we knew about exercise, nutrition, and all, but it's really important to take hearing loss seriously. 15%, 1/5 of middle-aged people have audiometric related hearing problems. That's a lot. And if hearing loss suddenly disappears, 800,000 people will not develop dementia in the next year. Remember, that translates into 8%. Hypertension, again, maybe 50 million middle-aged people have it. And 200,000 will not have dementia if the hypertension is fixed or it doesn't develop. Remember, there is a pre-hypertension stage. Same thing, there is a pre-obesity, and then you develop obesity, and it accounts for 100,000 people developing dementia next year. Excessive alcohol consumption. 21 drinks, you'll be surprised in our culture how common this is. And it's really hard for people to get their head wrapped around this. Again, in middle-aged individuals, you're talking about 10 million people have alcohol use disorder. That's a lot. TBI, traumatic brain injury. So make sure we all wear our helmets, seat belts. I would go as far as to even worry about contact sports that increase head injury, especially in children, adolescents. So air pollution, again, we forget that, we live in an environment where the environment will matter. If you just check your phone and check the air quality index in, say, Boise, Idaho, and check, say, Vancouver, Canada, you'll be surprised. The number over there is like 3, and our number would be, say, 40 plus. So that's a lot of air pollution. It, by the way, also leads to atherosclerosis, all the muck getting into our arteries. And so we are at risk of heart attacks and strokes besides dementia. Smoking, as well as passive smoking, 500,000 people won't have it if smoking just disappears. Nobody smokes. Diabetes, 100,000. Remember, that is pre-diabetes stage. That's where we need to start. Physical inactivity, 2%, 200,000. Depression is 4%. Remember, so it's higher than physical activity, diabetes, and hypertension. So we really, and this is where that biopsychosocial, spiritual approach comes, where we need to really take care of our mental health besides our physical health. Social isolation, we all know about Dr. Vivek Murthy, our Surgeon General's passion to really address this epidemic of loneliness in our country. I think it's everywhere. And there are studies to show, by the way, that if you have pets and you're living alone, maybe you'll have less risk of cognitive decline. So a plug for pets. Now, again, these are not amongst the 12 established risk factors, but sleep disturbances, I would say, is the 13th factor. I think it's established, but we'll wait for all the big shots to also agree. And then there are two protective factors. If somebody says, what are you going to do about this? You say, all right, I'm going to focus on increasing my physical activity, make it more regular, and I'm going to improve my nutrition, eat a balanced diet, and avoid SAD. Just write in the chat what I mean by SAD, and then I'll answer the question. Then I say avoid SAD, SAD, in the concept of nutrition. So you say, so how all these things really help? Well, multiple mechanisms. It's not just one. So cognitive reserve is like your brain bank balance. How many synapses you have, how many brain cells you have, how well you utilize what you have. So it's not what you lost that is important, but how efficient your remaining existing neural networks are. And then again, all these factors influence your vascular health in the brain. It will reduce the amount of misfolding of proteins so that they don't become toxic. The inflammation will go down. The oxidative stress will go down. There'll be more neurotrophic factors, and that's what will protect our brain. If somebody says, can dementia be prevented? You would say, European Center of Dementia Prevention says yes. Can it be delayed? Yes. Is there a cure for Alzheimer's disease? No. Can it be effectively treated? Yes. So what are the PCP supposed to do? Well, I'm the PCP now. So I'll tell my patient, hey, what do you think about dementia risk reduction discussion to be part of your annual wellness visit? Let's say you're the patient, you'll say, yes, Dr. Desai. Then my next step would be to say, all right, just for you to know, I'm struggling on this. It's a journey, So if you struggle, that's totally normal, but let's take the bull by the horn and really focus on all your risk factors. In a couple of minutes, I'll share what this is, Brain Care Score. And it's a resource that'll be made available to you. It's from McCann's Brain Clinic in Massachusetts. And you can get a score. And research shows that if you reduce your score, then you can reduce your risk of dementia. So, and then again, this like echo programs are the classic place for primary care physicians to come, get an updated evidence-based update on dementia risk reduction. I'll stop here and answer your questions. That's it.
Abhilash, you did it. Oh my gosh, that was quite the whirlwind. Please, if you wish to unmute and ask your questions directly, you may do that, or you can put them into the chat as well. And then, Abhilash, did you want to pull up those other resources in a bit?
Yeah, okay. Yeah. All right, so number one is, so hopefully everybody can see this Brain Care Score, correct?
Yes.
McCann Center for Brain Health. You can Google and it'll take you to the website. So if you have, say, high blood pressure, you'll get a, low score and then so forth. BMI, blood sugar. Cholesterol is here. It's not in the 12 risk factors, but I think dyslipidemia is important because of its influence on atherosclerosis, cerebral vascular disease, nutrition, alcohol. You'll get, if you drink too much, won't get any points. Smoking, exercise, sleep is here. As I said, many experts think that's an established risk factor. Stress, we didn't talk about it. We talked about depression, but to me, stress is important. Social relationships, and look at that, meaning in life. Interesting, right? But again, remember, biopsychosocial, spiritual approach. So meaning life, to me, it says that factor. And another resource for you guys is this document my wife and I have written. It's rough and tumble document on brain fitness and all the quotes. And then I have lots of acronyms. One of them is NE380, nutrition, exercise. So I include brain exercise here too, FYI. All right, let me stop here. Did anybody answer about Malala Yousafzai?
We had some answers in the chat. Thank
Good,
you.
good, good. And what about SAD, SAD? Standard American diet, sorry to say.
We have a question from Lynn Smith. Thank you. With so much information out there now on the healthier diet that will reduce risk, why are so many senior communities still serving the inflammatory inducing diet? What do you?
Oh, brother, how much time do we have, Lindsay? It's so many factors. It's hard to follow the straight and narrow. We all have food addictions, or I do, and it's a journey, and it also depends on, my social environment. My wife is much more into healthy diet, so that really has helped me really stay on the straight and narrow. And then you'll go to the larger social world, and then the cost is obviously an issue. Everything is crystal clear, Lindsay.
Any other questions? You see, we have another question in the chat from Joanne Belch. Recent news speaks of a new test for dementia presence or risk. What are your thoughts?
So there are a lot of new things coming out, including like blood tests and then some fancy artificial intelligence related brain scans that the FDA has approved something called Brain C. But again, we are not there yet. So everything you see is still in the experimental stage. So I would really urge you to, have a lot of salt around and have a pinch, if not more. And then talk to dementia experts about your own specific risk factors, modifiable, unmodifiable. But remember, a lot of these tests don't tell you what are the protective factors, right? Ideally, a fancy test should record all your protective factors, including genetic, all your risk factors, and come up with a score. And then I can say, all right, then I'm in business. Then if I get a score 80%, all right, then there is an 80% chance that I will develop dementia in the next 10 years, say, all right? So that has value because you've taken into account so many things that research has indicated. We are not there yet. All right, Lindsay, I'm going to put you on the spot. How is your journey about brain fitness?
Thanks, Abhilash. It continues to be inspired by people like you who I definitely am on the healthier end and make good decisions, but I continue to be inspired and I appreciate the constant reminder. So thank you.
So no stress in your life, you're saying?
You just made my face red. I don't know about that.
Of course.
So, okay, let's go back to Lynn's question. So to tag on to Joanne's question, do you recommend getting a gene test done if one family has there's family history so that one can know their risk score fully? And where can we have access to the scoring test?
Yeah, so again, should you do genetic testing, right? That APOE thing I talked about. Remember, it's in white population. And again, it all depends on your psychological makeup. Is it truly going to help you? Because I have most of my patients, I say that if you get worried, then you assume that you don't have APOE4, you have APOE2, and you relax. If you're not doing enough, then you tell yourself, hey, I could have APOE4, let me just hop to it. Today is the day that I'm going to draw a line in the sand and read a really brain healthy life. So the answer is no for most of the people. I don't think, there'll be benefits to it, but some of my patients just do it anyway. Then I guide them. I, help them understand interpret the results.
Abhilash, can you talk about, I think that's interesting, kind of the guidance pre and post testing, what that looks like?
Yeah. So again, so let's say you do APOE4 testing, all right? A white person. So let's say I recently saw a patient, 75 years old. Her daughter is 50 years old. They are Caucasian, white. So daughter asks me, should I do APOE testing? I'm really worried because you've diagnosed my mother as having Alzheimer's dementia. And, her sister had Alzheimer's dementia. You have two family members, and I'm aware of all these modifiable risk factors, but I really want to know APOE4, APOE4. I also tell her that let's say that you do the testing, are you going to share it with your sister? Because if you have APOE4, APOE4, and what's your relationship? What if your sister asks you what the results are? So we have to, and remember, this is a one-way street. You can't know and then not know it. So is it going to make you anxious every day? Then there'll be more results about this APOE4 influencing other conditions besides Alzheimer's disease. So, and if it spurs you to really radically alter your brain healthy lifestyle, then I would say, all right. And then again, once you get the results, let's say you get two APOE4, APOE4. I would tell her that that's just one. There are a lot of people who have two copies that never develop Alzheimer's disease, dementia, or any other dementia. So just remember that this is a risk factor. It's not destiny.